This episode of Beauty and the Surgeon podcast is brought to you by Let's Get Checked. Let's Get Checked is an online company dedicated to making professional health testing easy and accessible. Let's Get Checked offers fast, affordable, completely confidential at-home health tests from a range of tests from STDs, male and female hormones, and even COVID-19. Listeners of our podcast who are new to Let's Get Checked get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com, trylgc.com/beauty, BEAUTY, and be sure to use the code BEAUTY20, BEAUTY20 at checkout. Do it. Getting tested is important. It's the responsible thing to do, and you know how important I think it is to make sure you understand your labs. Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by the one and only Dr. Jason Martin, MD. He's a board-certified plastic and reconstructive surgeon, and wearing your slick new scrubs.
New scrubs with my logo on it.
How are you doing, Dr. Martin?
Pretty good. Doing pretty good.
Good.
And we have a great episode today.
Yes.
We can nerd out.
I love these
you
ones.
And I love to nerd out. I want everyone to get a cup of coffee to get their brains ready for some knowledge. We're going to drop some knowledge.
Yes. So we did this, it's been about 1.5 years since we did our first Research We're Into podcast. Then we talked about caffeine intake. Yours was about resveratrol pathways, right? Or no, the mTOR pathways. Yes. So this time we're doing Research We're Into 2.0, and we each have a really interesting topic to talk about. Dr. Martin's going to go first.
Oh, I'm so nervous. I mean,
I'll let you get into it.
What is everyone going to think? Okay. So usually we do bench research, and I'm sure Amy picked out an article that has like really basic science on there, or biochemistry.
Oh, it has complicated science.
Yeah. I, in the interest of our audience, to keep them engaged, picked a qualitative research study. And guess what? It was from my professional journal.
Ooh, maybe explain the difference between qualitative and quantitative. We didn't talk about that last time.
Okay. So qualitative is, why don't you explain it in a way that they understand?
Yeah.
So just on the baseline, quantitative is based on measurements, like scientific measurements and data points. But qualitative can have that aspect too. But qualitative are in most cases, at least in regards to plastic surgery, are based on things that are hard to measure truly based on data points, even though my study did use a tool that has data to it.
Yeah, I think something that most people might understand is when you do a pregnancy test, like a blood pregnancy test, a serum pregnancy test, you either do qualitative or quantitative, meaning you're either looking for the presence of a certain amount of pregnancy hormone and or like the presence at all, essentially.
Yeah.
So if they have it at all, or how much they have. So how much they have would show like where they were along in pregnancy based on the level of hormone versus there is this hormone at all, they might be pregnant.
Yeah, so a qualitative research would be, how do you feel about bears in the population? And a quantitative research would be, how many bears are there in the population?
What kind of bear is best?
Which bear is most attractive to you?
Pro or con, bears in the population.
Exactly.
Yeah, I grew up with bears as a part of my everyday life, so I'm kind of pro and con. Con when they're digging through my trash in the middle of the night, and pro when they're just looking all cute and they have their little baby cubs with them wandering across the yard. So
they are actually really cute when you see them, and then you realize they're deadly animals.
Yeah, until you see those claws coming at you. All right, sorry, let's get back to your study.
Okay, so I am a board-certified plastic surgeon. I say that over and over. Hopefully people care.
It's important.
And there's a national society called the American Society of Plastic Surgeons. They put on our national meeting. They're stodgy and kind of annoying, but they're
hating on the man.
I know. Very important, and they do a good job, and they really do try to put out honest, good information. There's a journal associated with that society called the Plastic and Reconstructive Surgery Journal, and this is the main journal for plastic surgeons. These are, articles that are published, are peer-reviewed, and go through an editorial process that's very rigorous. So anything that gets in this journal actually has a lot of weight and validity to it. If you've heard of Lancet, it's not that good. If you've heard of, what's another one? These medical journals that you get these.
You just kept, that's fine.
I don't know.
National Institute of Health.
Yeah, exactly. These important journals.
Scientific American.
Like, for example, what we're going through now with the issue we're dealing with currently, those articles are published in major journals, and that's where we get this peer-reviewed study. So this is what I got this article out, but it was actually qualitative, and that's what drew me to it because I was like, wow, my journal is usually so data driven, so quantitative. And it said in the article, and it was the article title, I'm such a normal human being. I was caught by the title, Can You Trust What You Watch on YouTube?
Which I'm so excited to hear about this article.
So, I mean, can you? And this is almost like political. Is it fake news or real news? Can you trust? And, you know, just to cut to the chase, which I'm sure everyone knows, you really can't. And they looked at 12 of the most popular plastic surgery procedures. This was in 2016. And they looked at the 50 most common or the highest. They went through they went through YouTube. They specifically studied YouTube, and they went and found the 50 highest ranking results from search. And they looked at all those videos on YouTube. And they did the 12 most common procedures. And then because
Do you
this
know
was
what they were?
all the procedures, yeah, we can go through the list. It's on here. It's all the ones you could think of that, you know, we've every episode we've had on plastic surgery, they've had one of those procedures represented. And they also added at the end, because of topics that we really have not discussed on this podcast, BBL or Brazilian butt lift, due to the dangers associated with that procedure.
Yeah.
So it was actually 13, and then looked at all those. When I was reading through this and through their discussion points, what percentage of the U.S. population uses social media?
Of U.S. population?
Yeah.
Oh, I'd say like 80%.
Did you read my notes?
No, I did not.
Okay.
Is that in your notes?
Yes.
Oh, okay. It's not on the screen, so no.
How many hours a day do people spend on social media on average?
Oh, we talked about the phone use the other day. I mean, just on social media alone.
It's insane.
Like 5 hours?
No, okay, come on.
Well, during these times, during quarantine times.
Yeah, quarantine.
Okay,
5
so
hours.
how about 2?
Did you read my notes?
No.
This sucks. I was going to come at with thunderbolts, you know? All right. So, yeah, 80% of the U.S. population is on social media, and 20% or in 2 hours a day is the average amount of usage. So, Amy, what do you think the biggest search engine is right now?
Google.
Okay. What is second?
YouTube.
So, Google owns YouTube.
Mm-hmm.
FYI, and Nils told me this, under like 35 years of age, the primary search engine is YouTube. And that you're going to see a cross where YouTube in time is going to take over Google, is going to be the number one search engine. So they're referring to YouTube as a social media channel, but in reality, YouTube is becoming the most important search engine. Google itself is prioritizing video results over written text results. And why is that?
Because that's what people want.
Because
people don't like to read.
We're lazy.
Yeah.
Okay. People don't want to read. They just want to watch a video, relax, and do 3 things at once. And that's what we're seeing. And that's concerning because here's why. Google has algorithms that read stuff. The bots go out and read the text that's on that page, and they can flag things that maybe are not correct. Okay. Or they may rank it differently based on the information you're providing. Right now, Google really cannot translate videos, okay? They have some technology that can do that, but they're not going through and scrubbing these videos and telling you what's correct or what's not. And that's a problem, right? Because if a majority of the people are going to YouTube for information and that information is not being vetted, and really the reason they're ranking high is because of interaction, not because of validity or truth, then you may be watching the number one video on YouTube on liposuction, and it may be completely and utterly, totally false. Should I just stop talking
I think you
now?
should stop there.
Okay.
Yeah, mic drop.
Yeah, exactly. We've been mic dropping all day today.
Yeah. We're dropping some big knowledge bombs today.
So unfortunately, nerdy plastic surgeon groups, and this is out of a university, looked at this because they aren't too flexible, but it is a really interesting conversation. It's something that Amy and I talk about all the time in our private practice, and for this is the reason why we have this podcast, is to get real information out there that talks about a lot of things that people don't talk about. Risk, complications, like what you have to do before surgery, what you have to do after surgery, who is not a candidate, you know, what the limitations of the treatment are. If you actually go watch I challenge anyone to go put in something you're considering, a facelift. Go look at that and look at it on YouTube. Everything is so glowy and positive. Like, look at this amazing result with this amazing surgeon with no complications, and it's amazing, and no recovery. And that is not reality.
Well, it's like that show, The Swan. I mean, they'd show people like 6 months after surgery and pretend like it was 4 weeks later.
Right. Of course, you have to bring up The Swan, which is like early 2000s, which shows our age.
I'm old.
Most of the people watching this are like, what the hell is The Swan? Okay. Anyways, so
If they need a facelift, they've heard of The Swan.
That's true.
So there we go.
So they went on YouTube. This was in 2016, and it was really interesting. They had doctors as like the main people in the study, but then they had these bachelors of science kids, basically. I'm calling them kids. They may be older. I don't know. And they're the ones that watched the 523 videos. Maybe that's why they did it in 2016 and published it in 2019. And average length was 5 minutes. So they spent a lot of time.
Yeah. But that's pretty short video to really discuss surgery.
They used a tool created for analyzing medical information. It was called the Ensuring Quality Information for Patients instrument.
Ooh.
Yeah.
Does that have an acronym?
I'm sure. EQI. I don't think it does. Okay.
You kick.
There was 27 different variables they looked at. And let's go on to the next one. This
is it. This is the EQIFPC.
Yeah. And so, Amy, you can read some of these, like address quality of life issues, description of how complications are handled. Basically, what they were looking for is what you would get if you went to a board-certified physician and they actually really talked to you about the risk and benefits of the procedure. And they looked at other things too: identification data, date of issue, logos that are present, names of the persons involved and their qualifications, structure data, like the language that was used, a respectful tone, balanced information, logical order of presentation. So it wasn't just the discussion of risk and benefits, but that was the main thing. They all the videos they looked at, this was really interesting. 310 were made by doctors or published by doctors. 108 were published by patients. And then 100 were other sources, which I'm assuming are the actual companies themselves.
Yeah.
Mean length was 5 minutes. So out of 27, and it's binary, meaning it's either yes, they did this, or no, they didn't. It's not this is a qualitative study, but this is where you get into using data points. Like, yes, they addressed quality of life. No, they did not. What do you think the average score was?
Out of 100? Is that what I'm going for here?
Yeah. No, I'm sorry, out of 27.
Oh, okay.
So 27 data points. What was the average number of positive, like they did do this?
40.
No. Out of 27. Now, I want to say that our practice does 40. We go above 27. We do an extra 13.
Okay, so we're not like for
Why are we struggling with math?
We have trouble with, I have trouble with math. So how many yeses did they get on
the 27 points they looked at?
10.
Really, that's pretty close. So it was 13 was the average. And actually, when you look at it on breakdown between doctors, patients, and other companies or others, doctors had the highest score. And then patients were a little bit lower, and then the other companies were a little bit lower. But so of all the things they looked at, and we could go through and you can look at this study online, they only fulfilled 13, like only 50% of all the things that they felt was necessary. And these questions were created by board certified physicians at an academic institution that really do know the ins and outs of these kind of procedures. Okay. So pretty alarming.
Yeah. And it doesn't mean that the videos that didn't meet those things were bad. It just doesn't mean that they were truly educational
and
or accurate.
Accurate. Yeah.
Yeah.
So that's the real problem here. I have no problems with social media. We do it. We put things on there. They're glowy and people looking great and like, oh, it's so much fun. Look at this. But if you are using YouTube as a search engine, you, the patient, and using it to search real information, at least per this study, which was pretty exhaustive and then went through an editorial process and peer review and was published in one of the most recent PRS monthly publications, then you're probably not getting really good information. So there are limitations. If the average is only 5 minutes, I mean, how many things can you talk about in 5 minutes?
That's what I mean. Like, that's not a long time to talk about a surgical procedure.
Right. And YouTube is used for business development. I mean, that's what people use YouTube for. I mean, in the old days, YouTube was actually used for creative outlets, but that's like gone. Everyone on YouTube is trying to monetize, right? They're either trying to monetize by advertising or monetize their business by putting out these kind of informative yet marketing kind of videos. And we do the same thing. So I do think it's really important that if you're thinking about proceeding with one of these many procedures they discuss, which was breast lift, breast reduction, blepharoplasty or eyelid procedure, breast augmentation, rhinoplasty, nose job, facelift, tummy tuck. We have episodes about every single one of those. That when you just go on YouTube alone, it's not giving you the full picture.
Yeah. You know what I would find even more fascinating is, my goodness, if they did this on Real Self, like,
right.
I feel like they would find much more inaccurate information because it's so patient driven.
Right.
You know, there are doctors on there doing videos and answering questions, but so much of the content on there is anecdotal from patient experience, and you can't believe everything you see. And I think this is a powerful reminder of that. So even videos done by physicians and the manufacturer of these devices are still only, I mean, if we were to put that in a percentage, you know, that's 30%.
Right.
30 to 40% accurate. So my 40 was correct. It was just I was not getting a number. I was getting a percentage.
Yeah, exactly. And
I was sort of right. My math was okay.
And I don't want to dissuade people from going on YouTube. I mean, we depend on YouTube. This podcast.
Jason Martin, MD.
Yeah, Jason Martin, MD. This podcast has grown our YouTube channel because we really do put out information. And I would argue, actually, looking through this, I think we fulfill most of these data points. We're definitely higher than 13 for Beauty and the Surgeon because this is an educational podcast that puts out real information. So if they watched our video, I would say we would be an outlier, score really high.
Yeah.
So, but it doesn't change the fact that high majority of things you see on YouTube related to plastic surgery procedures are not going to be the full picture. And they're not going to include things that have negative consequences, complications, recovery, pain, swelling, quality of life, that kind of stuff. And they may not show, this is interesting, they may not really show the credentials of the people in the video. One of the things they did not look at for the doctor created videos, if the doctor was board certified or not.
So they didn't go check to see if the doctor was board certified?
No. That would have been a better extension of the study to see, okay, the doctor videos scored the highest. Let's look at the qualifications of the doctors doing this. Are the doctors actually plastic surgeons? Or are they non-plastic surgeons trying to do plastic surgery procedures? Are they board certified or are they not? Interesting.
Yeah, I think this is a really interesting study. I mean, I personally use YouTube a lot. Like when I need to know how to charge the battery on my strange European automobile.
So this is what got me thinking. So you kind of understand. I mean, I don't think it's to be a surprise to people watching this that YouTube videos made by plastic surgeons are going to be like glowing and salacious and stuff because they're trying to drum up business. But what about those true educational videos we watch, like on how to repair the compressor on your refrigerator?
Yeah.
Or like how to install, on the smoker, how to install the LED screen.
Yes.
Like you always wonder, like, oh my gosh. Because I'm just like everyone else. I assume that, this guy's probably being correct. He's putting out educational information, but is he?
Oh, see, I always watch more than one. Like if I'm looking for something complicated,
so you're better than I am.
I'm like, I'm going to watch 3 and make sure they all say the same thing.
If it's something mechanical, if it's like an older dude and he doesn't seem to be comfortable on camera, I'm like, that's the guy I want to watch.
That's my man. Yeah. No, that's very true. Yeah.
Okay.
Awesome.
That's it. Basically, moral of this story is, and this is a really good study, is really be dubious of information, get multiple sources, and definitely go on Google too and try to look at, actually studies if you can.
Well, or just get a consult with a plastic surgeon.
Yep.
Yeah. All right. So we're going to take a quick break to learn about our sponsor, and we'll be back. Dr. Martin, I'm super excited to talk about our sponsor for this podcast, Let's Get Checked. If you've been a listener of our podcast, you know that we have never had a sponsor before, and that's because we're an educational podcast. We're not looking to monetize, and we also would never recommend something that we didn't believe in and or use ourselves.
So basically you're saying we're very choosy.
We're very choosy when we come to our 10 testing, but Let's Get Checked really aligns with our values. We talk a lot about monitoring your blood values of certain things. We talked recently about vitamin D serum levels. We talk a lot about hormone levels, and it's hard for some people to get to a lab, or you're afraid of the blood draw, or just, you're concerned about confidentiality. Like, you have a lot of concerns and you just don't do it. Let's Get Checked makes it super easy because it's completely confidential. You do it from your home. So there's really no excuse not to do it.
Yeah, and we did it recently. Both Amy and I did it. She looked at her women's health, basically her hormone levels, and I looked at mine on the men's health side with testosterone. It was very simple. You go online. Their online interface is really easy to use and good. We got the testing kit very quickly. And the test itself, actually doing the stick, you do a stick on the end of your finger, is not hard to do. It only took about 3 to 4 minutes. You put it back in a sealed envelope that's confidential, goes back to them. You get your results in 2 to 5 days. It's really that simple. And the best part is it's about empowerment, about you taking control and trying to do things that are positive for your health and life. And this is one way to do it, literally from the comfort of your own home.
Yeah, so they offer a wide range of tests. So they do men's and women's hormone panels. They do a full panel of STD testing. They also are now offering a COVID-19 test at home. So there are a lot of other just basic blood levels that you can get tested as well. And one of the things that we always say is you can't track what you don't check. So you might not know what's normal for you in the future if you're not checking it now, especially as it relates to hormones. And men's health specifically, I feel like, is a little bit undertreated. I mean, sperm counts are dropping by a large percentage in men these days. Most men struggle at some point in their lifetime with low testosterone.
And those men do not know what the symptoms of low testosterone are. Depression, anxiety, sleep problems, osteopenia or loss of bone, loss of muscle, and something we treat all the time, gynecomastia or male breast growth. These are real problems that can be improved or treated with testosterone. And these men do not know their levels. It's so easy to get checked. And this is why we're so excited about the sponsor.
Yeah. And Let's Get Checked is a completely CLIA certified lab, the CLIA lab. So they're a well-established, completely safe lab to use. You do get contacted after, so you get your results. I got a text at 4:30 in the morning, which I loved, that my results were ready.
And we're both up at 4:30, so that was good.
Super excited. And you have access to not only a nurse, but also a physician. So a physician does review your results, and it gives you a little breakdown of like where you're sitting on those levels. Dr. Martin's had even comparisons of like where 2 of the levels should be in relation to each other, which is a really important thing to note.
Right.
Just being within the normal range is not always enough. So it really gave more information than that. You'd still want to, of course, reach out to your own doctor if you needed some additional assistance with these labs or you did see something that was concerning. We didn't, thankfully, so that was good.
Yeah. We were both good. This podcast is about empowerment. It's educational. In my private practice, I'm a board-certified plastic surgeon. We are all about empowerment, and this is one way to do it. So we're very excited about the sponsorship, and we're looking forward to using it for our patients moving forward.
Yeah, so as a listener of our podcast, if you're also a new time user to Let's Get Checked, which a lot of you probably are, we do have a 20% discount code. So you do need to go to our specific URL, and it is linked in the description box below, but it's going to be TryLGC, so TRYLGC, like Let's Get Checked.com/beauty, BEAUTY. And you'll need to use the code BEAUTY20 at checkout. Beauty again is BEAUTY 220. And you can pick a test, like any test you'd like, put in our code and get your test shipped to you. Getting tested is the right thing to do. It's lets you know where you're at and what's responsible.
All right, well, let's get tested.
Let's get tested. Let's get checked.
Let's get checked.
Welcome back, everyone. So now it's my turn to get all nerdy and talk about research I'm into.
So now we're going to quantitative. We did our qualitative study. Now we're going to quantitative studies.
Yes. So my study gets pretty deep, but the title of it, and this is in Nature Communications, it is recent. It's from May of 2020, called Epigenome Environment Interactions Accelerate Epigenomic Aging and Unlock Metabolically Restricted Epigenetic Reprogramming in Adulthood.
Can you add a couple more sentences to
more
that title?
Epigenetics. So this was
my title was, Can You Trust What You Watch?
Mine is, so what is that saying? So basically we've talked a lot about epigenetics on our podcast. So it's basically the way our genes express. So what this study was looking at is environmental interactions with the genome at specific parts in gestation, essentially, and how that might change the way an organ functions in adulthood. In this study, they were specifically using the rat model. So this is not a human study, but I will bring up a human kind of connection here. So anything, as we talked about in our first podcast about research, a lot of research about nutrition and about, that becomes human-related research starts in animals. So if you are offended by that, I do apologize. These animals were not mistreated in this study, and they were not killed or had any abnormal changes to their life cycle, but there were some interesting interventions. So what they did to kind of hijack this change was they exposed a gestating rat to BPA. And we've all kind of heard BPA was really big in the early 2000s.
That's what's in plastic that people get very concerned about.
Right, was in all of our plastic bottles, can leach out. It's a estrogen disruptor, like it causes hormonal disruptions. It's not great. So they would basically, and the dose they used was not a deadly dose or like an extreme dose. It was what was considered like a safe, normal dose that an animal or a person would be exposed to. So that's why I really appreciated this study. So it's not like studies where they, are giving a rat like its body weight in a substance and then saying it causes cancer, because we know that things are dose dependent. So they gave them a small enough dose of this BPA exposure at a specific point in the development of the liver. So basically where the liver goes from kind of being a developing organ to being more of a metabolic organ, essentially. Because we know the liver is pretty much amazing and does like so many cool things. And then they followed these rats throughout life and made one key change to them at about day 70 of life. They started feeding them of what they considered a Western diet. So we're talking about a high fat, high fructose, high carbohydrate, and these are refined foods.
I did not see that this study was going there.
Right? Surprise.
Yeah.
So
it was a twist.
It is.
The BPA alone got me, but now we're going to feed them a Western diet.
Right. And that's the part of this. It says to unlock the metabolically restricted epigenetic reprogramming in adulthood, because I know everybody knew what that meant right off the bat. So they found that when they would change these, there was very little change. When these rats were born, there was no apparent change from following them and a rat that had no exposure. Even though they had a slightly larger liver at birth, they didn't show any outward symptoms. They weren't overweight. Most of their lab levels were normal. But when they fed them this Western diet, they very quickly accelerated into an extremely aged life cycle and very bad metabolic health, which was really interesting to see. So this happened more significantly in male rats and not female rats, which they didn't go into a lot, but they exhibited an altered metabolic phenotype that distinguished them from the vehicle-exposed counterparts on the same diet. So the ones that had exposure after birth were fed the same diet, and the difference was seen clearly in these ones that had the in vitro BPA exposure. The male rats exhibited significantly enlarged livers, but no change in body weight or increased serum alanine, which is the ALT levels, so the liver damage levels at birth, relative to the same rats. But when they started being fed this Western-style diet, all of these changes were extremely accelerated. And there's some really, if we scroll down here in this study, there are some extremely complicated looking graphs and charts like this one. They broke down, oh my goodness, they go into so much detail in this research article talking about the specific genetic markers, hundreds of specific genetic markers that they followed in the rats from both categories. Really, really interesting study.
So the phenotype changed once they gave them a Western diet. And the Western diet, again, is what?
So for them specifically, it was...
Is it Chick-fil-A?
Well, basically, yeah, high fructose, high carbohydrate, high fat. That combination, and to be fair, rats in a lab are being fed pellets their entire life, which are like they're a manufactured product to contain the nutrients needed for survival. That's not a natural diet for this animal by any means. However, it's a consistent diet. And when they changed the diet for both the rats that had been exposed in vitro and the ones who had not been exposed, the difference in how their liver reacted was dramatic, and not just in the ways that they thought it would happen. So it wasn't just impacting the pathways that would normally be seen with disruption from BPA. It really impacted a lot of things. Their cholesterol, their lipid levels, their hormone expression, like so many things then became disrupted that were not directly associated with BPA exposure, which is what I found super fascinating. And all of this, like I said, this article goes super deep. The one thing that they come back to in the end also is talking about how we're realizing more and more that our genes can be altered in a way that might lay dormant until an outside factor starts affecting them.
So that's what the cool part is. So you think about epigenetics. We've talked about this before. I forget which episode. Help me out, Aim.
Oh, like all of our episodes.
Everyone.
Epigenetics.
So
love it.
DNA is the blueprint. DNA has two strands, like a ladder. Just think of a ladder, and it's twisted, and then it in a three-dimensional way folds upon itself and makes this kind of really complex structure. That complex structure, how the DNA folds on itself, is related to your epigenetics. When that is abnormal, it can expose area of your DNA that should not be exposed. It can make it difficult to repair, mutations and things like that. And so BPA is doing something to that epigenetics or epigenetic form that as they age and they eat a certain diet, that's exposing this problem. That's leading to this problem having a phenotypic result, meaning that changes in the appearance. That's what phenotype means. So interesting.
Yeah, it's really cool. And what I immediately thought of when I started reading this study, like even when I saw the title of this study, the very first thing I thought about was the Dutch famine study, which I know I've talked about before.
That's what I thought about too. I don't want to.
Because truly for nutrition and is very hard to study in humans.
Yep.
Because humans don't live that long. They also there are so many genetic factors that can impact their life, and that's what this study shows. Like you could have a normal appearing person and then something changes that on the outside may seem benign, like a change in diet. Well, changes that had already happened inside organs in their body that were laying dormant are now expressed because of that change.
Right. And so the ethics involved with studying nutrition in humans and those, what do you call those wards? I always ask metabolic wards. They used to do that in the old days, and it's just really considered unethical now. And then also, so now they do nutritional studies based on population data. But
which is hugely flawed.
Yeah, it doesn't ferret out all this stuff. It's way more complicated than that. So you'd have to get down to the granular, to the DNA, to the biochemistry, and up to this. I mean,
even that can change. It's changing based on how your genes are expressing in that moment. So it's not static.
We don't have a full understanding, and that's why you have to use rats. I mean, I agree with the general feeling about that, but that's the only option we have. Their life cycles are short. You can put it into a laboratory where everything's controlled, and you can extrapolate. I mean, rats actually, their DNA is, in comparison to humans, is pretty close, and so is chimpanzees. So they're a great, useful method for studying.
They are, but let's get back to the Dutch famine study because I wasn't done talking about that.
Sorry.
So because it really shows in humans a very similar effect that nutrition can have on your offspring, and that's something that they don't talk about. Well, they talk about, but they don't go into it in the study, is how that would affect these rats. So these rats were not allowed to have offspring, essentially. So we don't know how that expression of the gene would have affected their offspring, but the thought is that it would have. And we see this very strongly in the Dutch famine study. So horrible things happened in World War II, but the Dutch population was cut off from food supplies for an extended period of time. So what they did was they went back and studied births from 1945 to 1947 because it covered a broad range of when this famine happened. So babies that were born to mothers that were starved at certain points in their pregnancy, like the beginning, middle, or end, or that got pregnant after an extended period of starvation. So if they got pregnant at the very end of this time of famine, how did that affect their offspring? And it is a fascinating study because it's real people. Like these are real people who have these effects. And the incidence of obesity, depression, mental illness is so much higher in certain parts of the starvation study. And they didn't do, the thing that's cool about this study, of course, there can't be a double blind, but they did use siblings as a control group. So they'd take a sibling that was born outside of the range of the starvation study and a sibling that was born within it and compared them. So to see, you're getting a better comparison there of what maybe just runs in their family, right? Does depression just run in their family? Are all the siblings depressed? Do they all feel like they have a poor quality of life? And that they also took just other births at that time, but they didn't discriminate for any pre-existing medical condition. So all they knew about these people when they contacted them to be a part of this study was that they were born in this time frame. They knew nothing about the mother's nutrition aside from the fact that she was living in this country in the time of extreme starvation.
Well, in a sense, that was a population study.
It was, and it's the best one we have. It's unbiased in a lot of ways because they weren't discriminated. So they didn't know if the person had pre-existing conditions. They didn't know if they were disabled. They knew nothing about the person except they were born during this time frame. They agreed to be in the study and they did these questionnaires with them. So that shows very powerfully that the things that affect the mother during your development are going to affect you for the rest of your life. Specifically, the BMI studies were what I found so interesting because that basically is coding your body to respond a certain way to food insecurity.
Now, it's not literally testing their DNA, right? So this is making an extrapolation, but clearly it's an epigenetic
It's an
effect.
expression.
Yeah,
Yep.
it's an epigenetic effect. Yeah, you've talked about that study before. So interesting.
Yeah, it really is. And studies like this, that like I said, like Dr. Martin explained, can't be done on humans. In animal models, really are starting to show that those effects can be dormant and then come up. So feeding your body the right nutrition and doing the things that are healthy for your body, maybe you don't see that effect in your lifetime, but you will see it in your offspring's lifetime. Like what you're doing to yourself might not start expressing until your offspring is eating that same denatured, bad quality diet.
You were like so negative with these things you bring up. So not only am I screwing up my life, I'm screwing up my kids'
Pottinger's
lives.
cats. Yes, we'll prove that. And the other study that I didn't bring up, but that was kind of really interesting too right now, is talking about the breakdown of long chain fatty acids in a maternal diet and how that affects their offspring's intelligence. Really cool studies coming out about that kind of stuff. But it matters. And even within yourself, you may feel like you're really healthy. And a lot of people feel this way. And like all of a sudden, it's almost like a switch flips, and like they feel like nothing's different. All of a sudden, their health starts to decline. Could be that there was something in your body that's been, dormant, that you now have just shifted a little bit of how your expression, your epigenetics, how your genes are expressing themselves right now.
Yeah.
That is causing some of that. Autoimmune conditions are a key kind of, you see that they come on really rapidly. Like why all of a sudden do you have Hashimoto's? Why is your body now attacking your thyroid? Why didn't it attack your thyroid for 40 years? Like it's those little changes, those little stressors, those little insults to our bodies, whether they're coming from a chemical like BPA exposure, toxic exposure from other things, our bad diet, like those things have a compounding effect inside our body.
And that's what, age researchers like David Sinclair are doing. They've decided that there's you can't tackle all the problems.
Yep.
So they're trying to figure out the repair part. So once the insults occur, and he described it as a record, and no one remembers records with CDs anymore, but a record, once you scratch that, you can't fill in the scratch. So they're trying to find ways to fill in the scratch so the record never skips.
Yeah.
And, that's so interesting. And it's all related to DNA, epigenetics, DNA repair, and, insults that occur over time in our lives. And there's insults occurring all the time.
Yeah. Or may have occurred when you were gestating.
Right.
Yeah. Yay. I love geeking out on stuff. Makes me feel, so good.
It's heavy, man. It's heavy. All right. Well, so that's good. I really like our cadre of data and research we presented today.
Yeah, it was fun. We love research. And that's part of why we do this podcast, is because we do want it to be educational. So episodes like this, while not directly related to plastic surgery, are definitely related to overall health and wellness. So we hope that you enjoyed listening to them.
I mean, yours was, at least.
Yeah, yours was related to plastic surgery.
Yeah, that's true. That's true. Okay.
That was really good.
I'm with
So
you.
thank you all so much for listening. If you would like to see the video and the slides that go along with this podcast, well, there weren't many. You can find those on our YouTube channel at Jason Martin MD. We're also on Instagram at Beauty and the Surgeon Podcast. And we would really appreciate you leaving us a like, a comment, a rating, a review, sharing us with your friends. We do read 5-star reviews from time to time, and we'd love to have your feedback.
Yeah, we love your feedback.
All right. Thanks so much, everyone.
Thank you.
Don't forget to check out our sponsor, Let's Get Checked. Let's Get Checked offers fast, affordable, and completely confidential health testing for everything from STDs, male and female hormones, and even COVID-19, right from the comfort of your own home. And remember, new customers and listeners of our podcast get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com/beauty, and use the code BEAUTY20, beauty, BEATUY 20 at checkout. Get checked. It's the right thing to do.